Thanks so much, Morty, for jumping on and for giving us some of your insights and experience today. We appreciate it.
Absolutely. Thanks so much for having me.
Absolutely. So our first question is, what drew you to the ABA space from kind of the broader healthcare operations side?
Right, so I actually started out in the long-term care side of things in the nursing home industry. My first job in healthcare was an AIT slash assistant administrator. AIT meaning is administrator in training. I was going for, it's like a, depends per state, just to get my administrator's license. And from there, I was kind of about 2 years between two different companies. Then in my last company that I was there, they kind of asked me to help out in operations, so I kind of took that route. In long-term care, there's a lot of, I mean, you're dealing with the elder community, so it's more seeing the end of life kind of things. My wife is a BCBA actually for about 10 years. Yeah, she's been doing it when ABA was out of style. She worked for like the big national companies when they were mom and pop shops like way back. And I used to just like see her come home after you finish cases at 12, 10, 12 cases, and like just seeing the progress. And she used to come back. It was like when you see the progress in a case and there's such an immense like appreciation and gratitude, like you're actually making a difference in this kid's life. So going from the end of life kind of more depressing type of thing to being able to build so much for a kid's potential life that just drew me into the ABA field.
That makes complete sense. It makes complete sense. Yeah, there's a lot more hope and excitement on the ABA.
Yeah.
Yeah, that's awesome. That's awesome. So then, what have you learned about some of the unique kind of operational challenges of running an ABA practice over the last whatever it's been since you guys started?
So specific to ABA, I mean, any BCBA or anyone in the ABA field can attest to this. Cancellations on the whether it be the RBT side or the parent side for whatever reason, and they're always, I mean, mostly always legit, and sometimes emergencies come up and this and that. Now, when you're dealing with it on the RBT side and on the parent side, it happens a lot. There's always a kiddo stuck in between that's losing out on services. And you don't always have somebody to come in and switch quickly, especially if it's an RBT that doesn't know the case until they get up to speed. So that's a big hurdle that is specific in this field that I still haven't actually figured out how to navigate that fully. Now, an operational challenge in general in the field, healthcare is a challenging field to staff. It's not an easy thing. You go nurses in hospitals and nursing homes, aides, everything. They're rock stars, and it's not an easy field. Specifically in ABA, there's just an extreme shortage. I'm based in Nevada currently, first state, so there's an awesome organization there called Grant a Gift, Ackerman Center. I don't know if you've ever seen them. I was just reading on the website back in the day. They kind of around 10,000 kids under the age of 21 diagnosed in Nevada itself
Wow.
with ASD. Now, on the BACB website, there are about 579 BCBAs in Nevada. You can kind of max it around 10 to 12 cases per BCBA if you want to. Again, it's usually the average. That comes out to under 7,000 kids. So you have a 3,000 kid gap, and it's actually worse with RBTs.
Yeah.
So I had a parent call me, like they didn't even ask for anything. They're just like, "Hi, can I get on your waiting list?" That was the call. That's insane. There's a real gap. I don't know the answer to it, but there's a real gap of the amount of BCBAs and RBTs in the field, which we had kind of had to have to incentivize people to go into more, just the amount of kiddos that are in need out there.
Yeah, yeah. Yeah. I think that is the case in almost every state, right? There is just not enough
Yeah,
service
absolutely.
out
Yeah.
there for the demand, which makes sense. So you've worked on both the startup side and kind of the more established system side. How do you balance the scaling that is required in a startup with kind of making especially hiring choices and management choices personalized and person focused?
So in regards to the personalization, I'll put it in different words. Corporate and more mom and pop is the way I look at it.
Yeah.
It's inevitable that if a company scales and grows that it has to implement certain things just moving forward, that it can't be as personable as it was. I do feel to keep on, as it's scaling, to have the people that you're putting in those positions on a management level, let them be your hand in actually continuing that personalization, build it into the core of the company. That should be something that, whether be it a birthday card on the BCBA's RBT's birthday, or congratulating them on certain milestones, keeping it personal, letting them know that they still exist just because the company grew. They're just not a number anymore. They're still, you know what I mean? They're still part of it, and that you actually care.
Yeah.
You generally care. And regarding operational scalability, I personally am a fan of looking in the future. You know that you're going to need something. Let's say, random example, Central Reach is two ways of doing it. You got the enterprise. I went with enterprise off the bat, even if I didn't need it right in the start. But if you know you're going to need something eventually, train your BCBAs, RBTs on the stuff that you're going to need at some point in time. Then you're not going to be kind of gradually needing to get there and then switch over. So yeah, softwares, platforms, anything you're using in a corporate type of thing, start it now. That way
Yeah.
you did have to work.
Yeah. That way you don't have to completely adjust, completely retrain your team later. Yeah. I think there's actually a book called Built to Grow, and it talks a lot about that, of like, why
I gotta
do
check
it.
that out.
Yeah. It talks a lot about that. Like, why are you bootstrapping when you know that you're gonna need to hire something for that? Just
Yeah.
find a way to make it work now. That makes a lot of sense, and I bet it'll save a lot of time in the next 5-6 years as you grow.
Hopefully that's the goal.
Yeah. So you mentioned like there's always plans to growth. I think that's almost always needed in this space. How quickly are you all growing these days?
So I'm actually kind of new in the ABA space.
Yeah.
But yeah, it is growing. Again, as I said, the harder thing here is the staffing. If it doesn't exist, it doesn't exist. And there are a lot of companies out there looking to help those kiddos, and so we're all going around after the same 579 BCBAs.
Yep.
Actually, a lot of them operate in their own agencies already in Nevada. I've met some of them. So I met them on LinkedIn. So yeah, that's the kind of challenge, the staffing challenges I mentioned.
Yeah. How do you balance the new hires that you're making with? I mean, like, there's a huge demand, right? You need more. How do you manage that need with making sure that they're a cultural fit, with making sure that they're a fit for actual quality of service, that kind of stuff?
So I'll tell you what I look for in an employee. I think that somebody that has a collaborative team mindset, they generally work well with other people, especially in these things. You have to work, your RBT has to work with their BCBA, whether it be the clinical director, the parents. There are always a lot of people involved in per case. And sometimes you got to switch out and you put a new BCBA on, see if it doesn't work, or an RBT and stuff like that. At the same time, a positive mindset and personality, just it usually clicks. That's what I look for. And it usually yields good results.
Yeah, that makes sense. Hiring for a fit of personality, not just the technical certification.
Exactly. I mean, granted, most BCBAs, RBTs are still sometimes figuring themselves out. But I would say, yeah, for the most part, RBTs as well, they're in it for that reason. Nobody goes into ABA. I mean, I have a lot of times I just fell in, but then when I fell in, I loved it. And they stay there. And a lot of them go on to become BCBAs and continue on they're there because they love it. Nobody goes into just looking for a job. What do I do? ABAs, I feel it's that type of field. Like a doctor wants to become a doctor in a specific field. BCBAs, RBTs, they know where they're going. They know what they want to do, and they're usually great at it. And they have that personality that connects with the kids and the families. And
yeah, that makes sense. So last question for us then is, what's one, either like an operational fix or a tip or trick that you've kind of learned that other ABA providers should know about?
I think that at some point the ABA providers know this. This is just, I can talk for myself. Making sure your staff know that they are the company, they're the most integral part of it. This is not specific to ABA, but I feel in ABA it happens sometimes more than other places. They are the front line that they're dealing with the kiddos. They're the ones that are actually making the change. As much as you're providing the assistance to it and the support, just making sure that they know that at all times, that they're actually appreciated, acknowledged, and they're the rock stars that are making it happen out there and really changing generations, because at the end of the day, you're actually bettering the next generation and making it possible. I mean, I think the CDC put out it's 1 in 29 or 1 in 31 kids have ASD. That's a crazy number, and it just keeps on growing. And if we can make that difference, to give them the best lifestyle and to really make them flourish, then
Yeah. Then that's significant by itself.
those are the RBTs and BCBAs doing that. As much as we can enable, they are the ones that are actually.
Absolutely. Absolutely. Well, and that's also how you combat. I mean, in all of ABA, people are always talking about burnout being such a big problem for RBTs, for BCBAs, for almost
Oh,
any
it's huge,
role.
yeah.
Yeah, and I think one of the biggest ways to combat that, in my opinion, is showing actual appreciation from the
Yeah,
team,
absolutely.
right? Because the
The
parents might appreciate
BCBAs
it, but
is a lot of it. I mean, I could talk from my wife being one. Is it's an isolating job.
Mhm.
Especially if you're doing in-home services, it's a very isolating job. You finish your with the kid, with the family, your as many cases and clients as you have. It's the rest you're doing your whatever else that has to be done for the case. You're not in an office. You're not around other people, your coworkers, to a minimal level. So it's that creates burnout, and yeah,
yeah,
it's not easy.
no, no.
The real rock stars for it.
If it was easy, there would be more BCBAs, more RBTs out there.
Correct. Yes.
Yeah, no, that makes sense. That makes sense. Well, awesome. Well, thank you so much, Morning. We really appreciate having you
Absolutely.
on.
Thanks for the conversation. It was great meeting you.
Absolutely. Likewise. Thank you.